Now this is my continuing coverage of the healthcare bill. This is Healthcare Bill Part 17, and I'm going to talk about Section 2718, which you can find on pages 18 and 19 of the healthcare bill. And this section is entitled Bringing Down the Cost of Healthcare Coverage. What basically is going to happen is that each year the accounting records of these healthcare providers are going to be sent to the Secretary of Health and Human Services for comparison. Now, the comparison will be based on three things. Number one, on how much the healthcare provider is paying out to your medical clinics, your hospitals, so on and so forth, okay? So what they'll do is they'll say, okay, we're charging our group so and so amount of money each month to be a part of our healthcare system, okay? And for this premium that they're paying to us, we are paying X amount of dollars to the hospitals, to the local clinics, to the doctors, so on and so forth, even to wellness programs. So basically, what's going to happen here is the Secretary of Health and Human Services is going to get all this financial data from every single healthcare provider in the United States. And the healthcare providers have to show in this accounting data how much they're giving to the hospitals, how much they're giving to the medical clinics, how much they're giving to the doctors, the nurses, so on and so forth. If they have wellness programs, how much they're paying into these wellness programs, so on and so forth, and administrative costs as well. And the purpose of this is that the healthcare providers have to justify now the premiums they're charging to not only to your employer, but also to you. So these healthcare providers can't just keep upping and upping and upping the premiums that everybody has to pay without justifying it to the Secretary of Health and Human Services. Now, in one respect, that's kind of good, because I'll tell you what, the greed of some healthcare providers is just, there's no question about it. But how far is this going to go? I mean, you know, yes, it'd be nice if some of them would start trimming the fat, but then on the other hand, what are they going to start trimming out? And how is it going to affect your health care as they start trimming the fat? Is it that they're going to trim you? I mean, you know, here they're trying to send a glowing report back to the Secretary of Health and Human Services showing that every penny that you're paying in premiums has been justified. Well, that's going to put a lot of heat on these healthcare providers. So what are they going to do? Provide you with less health care? It's a possibility. So this may be a good thing and it may not be a good thing. It just depends. So it's kind of a question you have to ask to yourself. Are we wanting these healthcare providers to suddenly provide all this financial data and try to justify themselves on a regular basis? Or is that going a little too far, and is it going to affect my health care if they do this? That's a question you have to ask yourself. You have to ask your healthcare provider, and you also have to ask your congressman. I can't answer that question for you, but you can answer that question for yourself. And if you don't like the answer, do something about it. Alright, I will tell you more in a future video, so stay tuned.